This is our first topic of the Chapter 4, Infectious Disease, and Non-Infectious Disease. A disease is a particular abnormal condition of a body, or mind. There are two types of disease. The first is infectious disease. Infectious disease is the disease that can be transferred from one individual to another. The second disease is non-infectious disease. Non-infectious disease is the disease that cannot be transferred from one individual to another. Non-infectious disease normally is caused by genetic factor, or unhealthy lifestyle. These two types of disease will be detailed in the following section of the lesson. We first talk about the infectious disease. Infectious disease is the disease that can be transferred from one individual to another. The infection of disease is started from pathogens, and transfer through air, vectors, water, or contact. After being infected, the victim will show the symptom of the disease. The examples of infectious disease are cholera, tuberculosis, H1N1, ringworm, dengue. About the non-infectious disease. Non-infectious disease is the disease that cannot be transferred from one individual to another. Non-infectious disease is caused by the genetic factor, or unhealthy lifestyle. Non-infectious disease rarely to show symptoms like infectious diseases. The examples of the non-infectious disease are asthma, cancer, cardiovascular, diabetes, and high blood pressure. Now, we continue the lesson with topic, transmission of infectious disease. Infectious disease can be transmitted through the following manners. The infectious disease transmitted through the water. We called it as waterborne diseases. The infectious diseases that transmitted through the air, we called it as airborne diseases. The infectious diseases also can be transmitted through the contact of the patients with another individual. The infectious diseases that transmitted through the vector, for example, through the mosquito, rat, or fly, is called vector-borne diseases. This four types of the infectious diseases transmission manner will be detailed in the coming section of the lesson. We first talk about the waterborne diseases. Transmission of diseases through water usually occurs in the area that don't have clean tap water supply and a perfect sanitation system. Here are two examples of how the waterborne diseases are transmitted. The first is contamination by the feces that containing pathogens. The second, water supply is contaminated when flood occurs. Examples of diseases transmitted through water are cholera, typhoid fever, and amoebic dysentery. Transmission of diseases can be prevented by the following countermeasure. Ensure sanitation system is in good condition. Adding chlorine in water supply systems. Boil water before drinking. Washing hand with soap. Now, we talk about the airborne diseases. The disease that transmitted by the air is archived through the following manner. Through the droplet transmission and through the dust transmission. These two types of disease transmission will be detailed in the coming section. The following are the droplet transmission mechanism. Splashes of water that consists come out from the mouth and nose of patients when they do sneezing, coughing, talking, yawning, or breathing. These droplets will be carried by wind and spread to the surrounding area. When an individual inhales the contaminated air, may be infected by the disease. Transmission is faster and easier in crowded conditions and humid environment. The following are the dust transmission mechanism. When the spit from a patient with the pathogen dries up, the bacteria in it forms spores and spread together with dust through the air. The individual who inhales this air containing the pathogens will be infected. The following are the prevention of the airborne diseases. Covering the mouth and nose when we do sneezing, coughing, or yawning. Avoid spitting everywhere. Avoid being in crowded places. Keep the houses illuminated with sufficient light, as the ultraviolet ray in light can kill some microorganisms in the air. Most of the airborne diseases are the disease related to respiratory system, such as tuberculosis. Tuberculosis, TB, is a disease caused by bacteria, called Mycobacterium tuberculosis. It has symptoms such as coughing that lasts 3 or more weeks, coughing up blood, chest pain, or pain with breathing or coughing, fever, loss of appetite. Flu is the common diseases transmitted through the air. Severe acute respiratory syndrome, SARS. Influenza A, H1N1. Measles.